Welcome back, medical billing students and administrative pros, to this explainer. I'm going to tell you right off the bat, as a billing educator, I know the financial stakes of Medicare compliance are absolutely massive. I mean, they literally couldn't be higher. Any claim you send in with mistakes or missing info, it just won't be processed, period. The work you do day in and day out doesn't just disappear into some administrative abyss. It directly impacts the financial lifeblood of your practice. So today, we're focusing on Part 8 of our training, unpacking this whole complex web of Medicare administration to make sure you're protecting your revenue cycle right at the patient level.
Okay, let's dive into this compliance roadmap. Today, we're looking at CMS versus MACs, coverage policies like NCDs versus LCDs, understanding advanced beneficiary notices, the strict ABN failure rule, and finally, a quick compliance summary.
Section 1. National Oversight versus Regional Administration.
To process claims correctly, you've really got to understand who's pulling the strings behind the scenes. It's kind of a two-part system. Up top, at the federal level, we have CMS, the Centers for Medicare and Medicaid Services. They're the overarching federal authority establishing nationwide regulations for Medicare. But on the flip side, the actual day-to-day execution and regional processing of those claims, that's entirely handled by MACs.
So, what exactly is a MAC? Well, a Medicare administrative contractor is basically a private, commercial business that CMS contracts directly to manage regional Medicare claims administration. For those of you who've been around the block and remember the older legacy systems, MACs actually replaced the old local carriers who used to handle Part B claims and the fiscal intermediaries who processed Part A. It's essentially a modernized, streamlined way to handle the massive volume of daily Medicare transactions.
Section 2. Coverage policies, looking at NCDs versus LCDs.
Let's start at the federal level with the NCD, or National Coverage Determination. This is essentially a universal coverage judgment made straight from Medicare. It dictates whether the agency is going to pay for a specific treatment anywhere in the country. It's the ultimate federal baseline. Basically, if an NCD says a procedure isn't covered, well, it's not covered from coast to coast. And this brilliantly illustrates where the regional rules come into play. While CMS sets that strict federal baseline, your regional MACs actually have the authority to propose or adopt their own local rules. When a local contractor implements one of these policies, that resulting document is called an LCD, or a local coverage decision.
You might be wondering, when exactly does a MAC step in and create an LCD? Well, it usually happens in two specific scenarios to sort of fill in the gaps left by federal CMS guidelines. First, if there's no national coverage judgment for a specific operation or diagnostic test yet. And second, when a national judgment does exist, but it really needs more specific definition and local clinical criteria to be applied properly.
Now here is a super practical instruction for all you coders and billers out there. You absolutely must be aware of the local coverage rules of your specific Medicare contractor. Luckily, the vast majority of coding software can actually detect these local coverage constraints. You need to utilize your billing software scrubbing tools to catch these local LCD restrictions proactively, way before you hit submit. Because let's face it, preventable denials are a biller's absolute worst enemy. Make sure you're using those tools.
Section 3. Advanced Beneficiary Notices and Patient Financial Liability.
Here's the thing. A MAC will absolutely not agree to cover a treatment or diagnostic that CMS won't pay for under an NCD or an LCD. So when a clinician offers a treatment that Medicare most likely won't cover, you have to use an Advanced Beneficiary Notification, or ABN. This is such a vital revenue cycle protection tool. It's a formal, standardized written notice presented to the Medicare beneficiary explaining that this service is expected to be denied as not medically necessary.
So the crucial point is the legal significance of this document. It is absolute. Signing an ABN signifies that the patient agrees to accept 100% personal financial responsibility for the charges. By putting their signature on that line, the patient is legally acknowledging they're willing to take full financial responsibility if Medicare denies the coverage.
Section 4. The strict ABN failure rule.
Now we need to talk about provider liability, because this is huge. If your office fails to present an ABN or if the patient simply doesn't sign the notice before the services are delivered, the provider bears the full liability. The rules state very clearly the patient is exempt from having to pay for that service. Because you failed to execute the ABN correctly prior to the treatment, the patient is legally protected from the bill.
And the stark reality of this financial penalty for the provider? Exactly $0. You can balance bill a patient, $0. You can't collect from Medicare, and you literally can't collect from the patient. And you know, the only thing worse than a $0 claim is all the paperwork it took to get it.
Your practice is forced to absorb the entire financial loss as an uncollectible write-off. This is exactly why a comprehensive understanding of these rules is totally non-negotiable.
Section 5. Compliance Summary and our outro.
Let's move to and see how this builds our compliance workflow. Step 1, you've got to understand that division between CMS making national rules and MACs processing regional claims. Step 2, always check for NCD and local LCD restrictions using your software scrubbers. Step 3, if a service might be denied, execute a formal ABN prior to delivering the service. And Step 4, by following all these steps, you protect the practice and prevent those devastating financial write-offs. Federal rules dictate local policies, which in turn require proper ABN execution right at the front desk.
You've officially mastered the hierarchy of Medicare administration. Up next in Part 9, we'll be tackling Medicare claims processing rules, payment floors, NCCI edits, and the mandatory electronic funds transfer or EFT requirements. But before we wrap up, I want you to ask yourself a question. Is your front desk currently handing out ABNs after the patient is already sitting in the exam room? If so, just how much revenue is quietly slipping through the cracks? Think about it. Thanks so much for joining this explainer. Like, share, subscribe to Decode Healthcare with Harshal.